Really?
I have like a steam shower and a sauna, and I have a big bathtub, and I go hot and then go in the ice bath.
Fantastic.
Hot ice bath. It's like the best thing ever.
Well, it'll certainly wake you up and it makes you feel good, if nothing else. But I've looked into the data. I did a lot of research for the book. And so the cold stress, it'll boost your brown fat. Brown fat has a lot of mitochondria, puts out a lot of good molecules. So that's what you can do.
Cryotherapy is not nonsense?
I don't think so.
Yeah.
But, hasn't been long-term studies, but it makes sense.
Like a true Harvard professor, but there's not been long-term studies.
Yeah, I always have to do that.
You're tenured now. You can say whatever you want.
I get slapped on the wrist. But what's interesting about it is that the brown fat, we didn't know it existed in humans until fairly recently, only a decade ago. But it seems more you have, the better. And the best way to induce brown fat is to be cold, especially across your back. There's a lot of it back there if you can induce it. The problem is I found that, at least in animals, the older you get, the harder it is to build up. So you want to start early in life if you can and build it up then. The heat stress I looked into, and I was really skeptical that any of this was real. My wife told me about saunas. I went, come on, that can't be good for you. But you look, and actually there's a lot of studies in Helsinki.
Of course.
They're selling the saunas. So they've done a lot of research. So thousands of Finnish men mostly have been studied. And in those studies, it's pretty clear that men who go to the sauna a few times a week have less cardiovascular disease risk and heart attacks. Now, there's one caveat which they actually admit in one of the papers, is that people who are sick or in hospital don't go to the sauna as often. So there's that caveat. But I looked at the data. To me, it looks like it could be real. I do both. And
it does increase the resiliency of your cardiovascular system, and something called heart rate variability improves, and heart failure patients do better when they actually go in saunas.